High-altitude peril. How climate change is driving dengue into the Himalayas, a powerful new photo essay by photographer Yuri Segalerba, titled The Ascent of Temperatures, documents a shifting biological frontier in Nepal. The collection reveals a grim reality: dengue fever, the world's fastest-spreading mosquito-borne diseases migrating into high-altitude regions previously protected by the cold. A new frontier for disease historically. The mosquitoes responsible for transmitting dengue, Aedes aegypti, and Aedes albopictus were restricted to lower elevations below 2,100 meters. However, rising global temperatures are breaking these natural barriers. The S highlights Shandanath as a critical indicator of this shift. Situated at 2,438 meters above sea level, it is now one of the highest towns where these mosquitoes and their larvae have been identified. This migration suggests that as the Himalayas warm, vast areas once considered safe zones are becoming hospitable to disease vectors. The scale of the outbreak, the spread, is not localized, it is systemic. Recent data indicates a massive expansion of the virus across Nepal. Geographic reach. The virus has been detected in 76 out of 77 districts. Human impact. In 2025 alone, approximately 9,000 infections and 6 deaths have been recorded. The invisible threat? Experts warn these numbers are likely much higher than reported. Because roughly 90% of dengue infections are asymptomatic, many cases, and potentially many deaths go undetected by the formal healthcare system. The collision of tradition and science, the migration of dengue, presents a unique challenge to Nepal's cultural and medical landscape. Segalerba notes that this is a moment where millennia-old medical traditions are suddenly forced to confront a pathogen they have never encountered before. In response, a multi-front effort is underway to manage the crisis. Scientific monitoring, the Nepal Health Research Council, NHRC, in collaboration with the Institute of Tropical Medicine in Antwerp, is conducting rigorous research. Scientists are examining mosquito larvae and adults to detect insecticide resistance, whether mosquitoes are evolving to survive chemical treatments. Adaptation, how the species are physically changing to thrive at higher altitudes. Community education, academic institutions are moving out of the lab and into the streets. At Tribhuvan University, professors are conducting awareness campaigns in secondary schools, using live larvae to teach students about breeding habits and the necessity of eliminating stagnant water. Traditional and local defense. While modern science tracks the virus, local communities are relying on a mix of ancient and practical tools. Soa Rigpa. Practitioners continue to use traditional Tibetan medicine to treat patients. Preventative measures. In areas like Shandanath, the use of mosquito nets has become a vital daily practice for families to protect vulnerable members, including infants. Summary: the rise of dengue in Nepal's high-altitude districts is a direct consequence of climate change, creating a public health crisis that threatens both modern medical systems and ancient traditional practices. As mosquitoes climb higher into the Himalayas, the window for effective prevention and scientific adaptation is rapidly closing.